Positive notes come out of today's update. The vaccine is safe for pregnant women.
And Q13 News reporter Frankie Thompson joins us to explain how the surge in cases involving the Delta variant is impacting expectant mothers. Frankie.
Matt, health leaders with the Washington State Hospital Association say hospitalizations are increasing to crisis levels again. Not only that, they say for the first time in this pandemic, they are seeing unvaccinated pregnant women become critically ill. In Washington, 1,570 people are hospitalized with COVID-19.
Enormous stress on the healthcare system to have this many patients with a single diagnosis. This doesn't happen.
The Washington State Hospital Association says the alarming increase in hospitalizations is happening statewide. Swedish Medical Center says the Seattle Metro is experiencing the uptick.
We got down at Swedish to single-digit COVID patients, believe it or not, about 4 to 6 weeks ago. And now we're flirting with about 100 COVID patients in-house, and other systems like to the south have even more. And it's back almost as bad as it's ever been.
With hospitals quickly filling up with COVID patients, it leaves less room available for others. Multicare in Pierce County will be setting up tents outside of Tacoma General and Good Samaritan Hospital in Puyallup for extra space.
That is largely because we need to keep people out of our emergency room waiting rooms, because we're starting to have people that are kind of in a window of treatment that are having to be in those rooms, and we need to keep them safe.
Safety is priority for pregnant women. Health officials with Swedish say the surge in Delta variant cases is causing more ICU admissions, premature births, and maternal deaths.
It's heartbreaking to spend my day in the ICU taking care of women who are pregnant and may not make it and maybe leave their babies motherless.
Dr. Tanya Sorensen says this is the first time in the pandemic where they're seeing unvaccinated pregnant women get really sick. She says only 40% of them have both doses.
When our patients get really sick, it's pretty common to need to deliver them, and it's usually by an emergency C-section and sometimes even in the intensive care unit. And the reason for that is either the babies are getting distressed because their mothers are so ill, or that we need to deliver the baby to help improve the mother's breathing.
Hospitals in our state and across the nation are also dealing with an ongoing staff shortage. Here at Swedish Medical Center, the doctors say their staff is frustrated. They're burnt out, especially since they've been in this pandemic for so long, ever since it started 18 months ago. But the good news out of today's discussion is in this latest surge of COVID cases, the vaccine numbers have increased threefold. Reporting live in Seattle, Frankie Thompson, Q13 News.